ladies and gentlemen. Until just 40 years ago, people with mental illnesses were forced and coerced into mental treatment. But now, they are living amongst us in our society and receiving less coercive treatment, which is better towards them. And in 2012, in China, where human rights violations take place nearly on a daily basis, they have actually passed a law protecting the rights of the mentally ill patients unless they show intent to harm themselves or others, which is 1 out of every 11,000. So what does that tell you about the proposition who want to lock up these mentally ill patients, where China, where it's the motherlode of human rights violations, actually protecting them? Second of all, only for a tiny minority of people who commit a crime or show an intent, not now, or show an intent to do so, which is 1 of the 11,000. For this one, it can be he can be put in after his consent into a mental institution, but only after his and his family's consent, because we cannot force these people, the other 11,000 people, to be institutionalized or hospitalized or locked up in a prison just because only 1 of them show criminal intent. Second of all, in a study done by famous therapists, her names are Erickson and Western, it shows that over 2/3 of the people who were coercively admitted into mental institutions have later shown in later interviews that they have experienced abuse as a person. And like I said, most of the mass shootings that took place over the past 20 years have actually been from people who were undergoing mental treatment or actually have finished with their treatment. So why does that happen? Why does mass shootings happen after they finish the treatment? I'll tell you why. Because mandated treatment doesn't actually offer a solution. It just isolates them. It just exacerbates their violent intent inside them. And most of these mandated patients, they do not follow up on their course of medication after they get out of these institutions.
You have 1 minute.
And regarding the point that they mentioned, that the family can choose to admit these patients if they feel that they are becoming a burden. They don't have to put up with them. It's not a burden, it's their family members. They will do everything to take care of him, and if they can't, they can choose to admit him into a respectable hospital. And the course of dosage, you can say that the patient can die if they take the medication on their own. The course of dosage can be put by the doctor. He doesn't have to take it on his own, not now. He doesn't have to take it on his own and later die of overdose. And to sum up, imagine a family member, a brother or a sister, who have had an accident that caused him to have a mental illness. Imagine police officers barging into your home and taking him away and locking him up in a mental institution. When he come back, he would have suffered from electroshock therapy and damaging medications. He will never be the same again. He will never be able to continue his normal life. So we are gathered here today to put an end to this, to bring back the rights of the mentally ill.
Thank you very much.